Hi there, in this video we will be talking about behavior skills training, specifically on ABC data collection method. The behavioral skills training runs in a 4-step training strategy including instruction, modeling, rehearsal, and feedback. The pros of it is to increase staff competence, better client outcomes, and overall generalization of skills to build confidence among staff and competency upon skills being taught as well. The ABC data collection is a collection of the tendencies surrounding behavior. ABC stands for antecedent behavior and consequences, which also means where in antecedent, what happened, and what the behavior looks like, and also the outcome of the consequences. To show you an example of ABC data collection, we'll be using attention as the behavior being observed. Attention is operationally defined as the student looking around the room, talking with others, staring out the window, playing with items, and or resting, banging his or her head on the desk. Under the antecedent, we would be writing where it happens. So teacher asks a student to come to the blackboard to move a magnetic marker. As for the behavior, we would jot down how the behavior looks like. So in this case, Samuel bangs his head on the tray of his wheelchair. And as for the consequences, we would write the outcome of how we handled the behavior. The teacher goes to Samuel and attempts to redirect and soothe him with a preferred item. For instance, this case will be a Spider-Man doll, which is his preferred item. The function of the behavior is attention, since it takes the teacher's attention away from the other child. So common environments where this method can be used is when anywhere the behaviors occurred, including classrooms, home, therapy settings, or any community that the behavior occurs. Some may ask, who can collect ABC data? Anyone who has been trained to do so, including staff working with the client, teacher, therapist, etc. Also parents or caregiver, supervising personnel, but the person collecting the data would need to be able to read and write and be able to be objective regarding the behavior and consequences. How the evaluation is being done. It's done through direct observation of the task with a performance checklist. The checklist is acquired with a clipboard with a ABC data sheet within 1 minute of the behavior occurring, and within the ABC chart form, here's a sample of the chart form used. So under the checklist, we're supposed to fill out the antecedent box, behavior box, and consequences box. When will evaluation be done? At the end of training session, 1 month after training in the clinical setting, or 3 months after training in the clinical setting. Why does it matter when we do ABC data collection? It's because in such way it allows for consistent data taking in regards to the objectively defined behavior. And with this type of data collection, it is crucial to be objective, honest, so training can lead to this being done more seamlessly. And when ABC data is taken and used correctly, it assists in developing and understanding the function of the behavior, leading to hypotheses being tested in a more formal functional assessment, and it helps professionals to further develop a functional behavior analysis known as FBA and also ABPIP.
Good morning, how are you today?
I'm good, thank you. How are you?
Good, not bad, thank you. So, do you recall what ABC data is and how to collect it?
Yes, it's a method of conducting a descriptive assessment where you gather information about the antecedents and consequences surrounding a behavior.
Awesome, so let's try to practice ABC data collection skill. This training session is based on the BSD or Behavior Skills Training Model, which is generally used in a training session to help a person acquire various skills. ABC data is typically preferred method used when observing behavior. It requires direct observation and objective recording of what happened immediately before and after a behavior. ABC data collection can be used anywhere behavior occurs, including classroom, therapy setting, and home. But the instructor must be trained for using it. A few researches and literature supports the use of these skills, such as Borgmeyer and Stigland. Yeah. Beyond behavior, okay. How does it sound so far? Any questions?
I'm good, but is there a form for recording the information?
Yes, it can be done either in a narrative or structure. Today, I will show you the narrative document. And you can see these documents and this checklist box. This is the tool we use for recording the observations. Is there any question so far?
Can you just guide me through each box, like what it stands for?
Sure. For example, if you choose hitting as the target behavior, you would first define it operationally. Keep in mind it really should be objective, clear, and easy to understand. And there are each boxes. Yeah. So the client's problem behavior hitting. So definition would be the student using open or closed fists to make physical contact with others, where high fives are not included. Do you remember what antecedent was?
So that would be what happens first.
Yeah, that's correct. So teacher asks a student to come to the blackboard to move a magnetic marker. And the behavior is what the behavior is involved like. So the teacher, so Samuel hits the teacher in the leg. And the consequence would be what happened after behavior. So the teacher redirects Samuel to the task without mentioning the hitting. Okay, so you can see the checklist box here. And
Okay.
So why don't you try? Okay. I'll show you how to do it.
Okay.
So there are three objects. Match the pen. Match the pen.
So the original SD was the antecedent,
Yes.
and the consequence was the redirection.
Correct. But remember to only write what you can see, not what you think. Let's do that one more time.
Okay.
Match the pen. Match the pen. Okay, I like how you were able to observe without interrupting the behavior. It is good that you were able to be objective. Try to give more space to the client while observing, and remember to only write what you can see rather than making assumptions.
Thank you for the feedback. I will keep that in mind.
Practice while in program. I will around to observe and evaluate. Thank you.